Okay, so good day. This is Donna Lea P. Buendia again, and I am going to discuss disorders of sex and gender. So, under this, we are going to discuss sexual dysfunctions and paraphilias. Okay, so when you say sexual dysfunction, this is a disorder that affect the normal key areas of sexual functioning of a person. If the person has a sexual dysfunction, usually they experience distress and sexual frustration, guilt, loss of self esteem, and interpersonal problems. So, most of the dysfunctions are interrelated, and many patients with one dysfunction might experience another as well. Alright, before we discuss the different types of sexual dysfunctions, let us discuss first the four phases of human sexual response. The first one, we have the desire or sexual ideation stage, wherein there is an increased libido or sexual urge of the person. Then it will lead to the excitement phase or arousal phase. If there is a continuous stimulation, it might lead to orgasm or ejaculation phase. After the ejaculation, it will lead to the resolution or refractory period, or also known as the resting stage. If you have a sexual dysfunction, you might experience any kind of dysfunction in the first three phases or stages of human sexual response. So let us see the cycle or the normal sexual response cycle of male. So starting from low desire, it will increase and will lead to excitement phase. Okay. For continuous stimulation, it will lead to the peak of orgasm and then slowly proceed to the resolution stage or the resting stage. Okay. Now, for female, the normal sexual response cycle for female, okay, from low desire, increasing, will lead to excitement and then orgasm. As you can see, there might be a possibility of multiple orgasm. That's why we have it here. And there might also be a possibility of a resolution without orgasm. Okay? So without this, it will just lead to a resolution or resting phase. So this is the difference between the normal cycle of male and female. Now, let us proceed with the disorder of desire. It is subdivided into male hypoactive sexual desire disorder and female sexual interest arousal disorder. When you say hypoactive sexual desire disorder of male, it is characterized by lack of interest in sex and little sexual activity. Okay? So in other words, they do not have any kind of interest in having sexual activity or desire in sexual activity. And there is a counterpart for female, the female sexual interest or arousal disorder, wherein there is a lack normal interest in sex, and most of them experience little excitement during the sexual activity. They are not aroused by any erotic cues, and they experience few genital or non-genital sensation during sexual activity. Okay, so this is the checklist for you to diagnose a person having hypoactive sexual desire disorder and female sexual interest arousal disorder, according to the DSM-5. They both must last for more than 6 months to be diagnosed. And these are the list of the symptoms that I have also discussed and enumerated on the previous slide. In the disorder of excitement, it is subdivided into two. The female sexual arousal disorder, the one that I have discussed, or frigidity, and the male erectile disorder, or formerly known as impotence. If the male experience erectile disorder, then there is an inability of an erection of the penis. Or there might be an erection, but they could not maintain the erection until the completion of sexual activity. Okay? And this must also last for more than 6 months for him to diagnose.